not desperate. We are only trying to beg you to do the right thing. But I am telling His Excellency, the time comes when you have to do the unthinkable. We cannot be witnessing every time industrial actions in Makueni. Makueni, if I compare in the counties, particularly in the eastern where I'm leading, Makueni is now beginning to go backwards in terms of management of human resource, and it was number one. But why are we seeing this? Why are we witnessing that issue? Because of having people that are not intentional, people who don't have a plan. You come in the office, you don't have a plan to implement the manifesto of His Excellency. There must be effective, robust workforce that is motivated. And they can never be there when you are using divisive politics, lying to the king, and moving around instead of sitting down and you set aside politics and you perform your noble duty. I think that is the most important thing. So we are requesting His Excellency to call and give directions that we sign the CBA, we deposit it in SRC, and we have had a task force that was concluded recently, highlighting the issues clearly. Centrally, we have agreed counties are supposed to comply to the demand notice that was issued on the date of 6th, last month nationally. So this strike notice is talking about CBA signing, is talking about UHC employees and the absorption centrally. We are talking about the honoring of the return to work formulas, both at count levels and nationally. And we are also finally talking about full implementation of the career guidelines. I want to address myself to the other counties in the eastern region. We know that Isiolo and Embu have equally not signed. And I want to call out the governors and request them to realize that signing off this CBS is going to alleviate suffering of the patients. There is no way you will sit in the office and have aspirations of getting back to the leadership when your people that you will be supposed to be electing you are collapsing in the houses. Those are the voters that you'll be losing. As I address myself to those other counties, I must actually say that we do not want to see the trend where some of the governors want to show hostility to members. We must say this: clinical officers are not on strike. The government is the one that moved away and abdicated responsibility by actually not honoring what we agreed when we were signing the return to work. The return to work documents we are talking about have already been deposited in court, and therefore they are court orders. So when you are not able to implement, you are the one on strike. You are the one on strike. So we are requesting the government to look at how best can we implement. What are the things we can do? Call us and tell us, this is the much we are able to pay in this supplementary, na hii kidogo yenye imebaki, this is what we'll do. And we are saying, let us utilize section L of the HR manual that puts unions as a key stakeholder. It's not just about politics every day. It's about ensuring that there is a functional engagement, not calling us when there's a crisis, and then from there you start now moving around lying. It has taken us 27 days out. We are affecting service delivery. Health is critical. And for the government of Makueni to achieve and to realize the results that it has promised people in its manifesto, they must have a functional, healthy human resource in terms of the villagers, in terms of everybody that is working. So the public is struggling. They have to come to Makueni County referral, which is not accepting SHA in terms of outpatient. So it becomes extremely chaotic. And somebody should not roam around saying that everything is well, all is well. It is true that there is serious crisis, and the crisis is man-made. And that is why I'm saying we need to call out people. If you are the accounting officer, you must be responsible. You must be held directly responsible. We should not have seen this strike. And let me repeat myself. On 20th April, and this is important, on 20th April, we had a meeting, the national team, in the county. We sat down with the Department of Health. The meeting was chaired by Waziri in the Department of Health. And we sat down and put on an increment on implementation of the issues that we raised. Now, which issues are these? One is the full implementation of the career guideline. Two was actually the CBA signing. Okay? Three was the Directorate of Clinical Services. Okay? And then we have also been talking about payment of gratuity of our officers that has never been done. We have also been talking about these hospital contracts that are ballooning in this county, setting a very bad precedent in the country. And we have also been talking about our program officers. So these issues, when we highlighted them, we were sent into a task force which we worked and concluded. And I must say, the timelines were clear. By 30th April, we needed to have signed the CBA. To date, the CBA has not been signed. What is the cost of signing the CBA? It is zero. It only requires you to append a signature. You only need the CS, the CEO Public Service Board, Waziri Health, and the Chief Officer Health Services to append their signatures and go and deposit that document in SRC. I have been engaging these offices day in and day out, to the extent that somebody is now saying the chair is moving every room desperately. We are not desperate. Of the 4 states, and my forever, solidarity forever, solidarity forever, for the union makes us strong. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. Viva Matabibu power. Viva Matabibu, viva! Viva! Viva Matabibu, viva!
Viva!
Solidarity forever. Solidarity
forever.
Matabibu power.
Power.
Matabibu power.
Power.
Thank you.
Solidarity forever, for the union makes us strong. For the union makes us strong. Solidarity forever, solidarity forever, solidarity forever, solidarity forever, solidarity